morning. It's a pleasure to have you here today with us for these Delcon Talks. So, as you know, with the Delcon Talks, we usually interview the partner and the stakeholders around Delcon that have very interesting projects, products, technology, or startup like yours. So, so I think you have a very interesting product at Walla, and today we want to know a little bit more. So, as far as I understood, you have this digital platform that connects blood centers with donors and incentivize donations. But also, you are connecting hospitals together. So you are actually helping hospitals to better manage the blood demand. So can you tell us a little bit more? So introduce Walla and tell us a little bit more about the product and how your product is helping in Ghana, where you're based with the blood transfusion business.
All right. Thank you, Barbara. Happy to be here, and thank you for the opportunity to talk to Delcon Cox. So I think basically maybe step back to the problem. So as a physician who worked in a couple of countries in Africa and also other developing countries, there's always the recurring problem of finding blood for my patients. And unfortunately lost patients because we could not get blood for them. So Walla is sort of an answer to address this problem. And basically what we do is to think about Walla as a platform where everybody can connect to. We have the blood banks who critically need to meet their demand and they are not able to meet it. Donors who want to donate blood conveniently and easy. And then also the delivery part which is also critical to make sure that the blood gets on time to save lives. So Walla is a platform that connects all these three players, blood banks, donors, delivery, and also hospitals to connect to each other to make sure that they meet their needs. And before Walla, there have been attempts by NGOs to sort of increase blood donation. But over the past 50 years, all these efforts have gone on, but still there's shortages of blood every year. So what we thought about at Walla is to use technology to help and solve this problem. And we believe that by connecting all the players on one platform using technology, we can help to solve the problem. So that's a bit more about Walla, yes.
Sure. So I think there are many interesting points. So let me address them one by one. So we'll say first, I'm curious to know more about how do you incentivize donors to donate blood. So I know you have this coins or points, sort of a reward programs. How does it work?
Thank you, Barbara. So we did a bit of research at the beginning, and we found out that about 90% of people who don't donate blood are the youth between the ages of 18 and 45 years. They have the capacity to give blood, but they don't. So we found out why they don't give blood. And number one, they mentioned it's not so convenient and they actually don't know about blood donation. And more importantly, they want to be incentivized to give blood. They don't see why they should give blood. And so we went back to the drawing board to sort of design a program that will get them excited. And that's why we came out with the Walla coin. So Walla coin is a digital token where you receive anytime you donate blood, you get a certain amount of these digital tokens. And anytime you refer a friend to also come and donate blood, you get the Walla coins. And anytime you share on social media, you also get these Walla coins. And you can do 3 or 4 things with the Walla coins. You can exchange it for a free medical checkup, which we have started with. So we have a partnership with the hospitals where we work, so that if you have your number of Walla coins, you can exchange for free medical checkup. You check your BP, you check your sugar, you check cholesterol, and a few other things. That way, we're able to help to know your health status. Secondly, we are thinking of, with the Walla coin, you can exchange it for telephone credit, which will help people to also actually be more excited and use the app, especially for young people who are all tech savvy and they're always on social media. And in future, if there's enough blood, you can actually exchange the Walla coins for blood, where with a certain number of Walla coins, you can exchange for. The whole idea is gamification to get more people to give blood. So you can pass on the Walla coin to your friends. You can also exchange it to one another. And through that, we're able to make sure that people give more blood. In future, we're even thinking of converting it into an NFT, where people can actually have a limited number of these Walla coins that have been endorsed. And through that, we believe it can build a whole network effect and get more people to give blood, yes.
That's great because also at Delcon we are very interested
Mhm,
in this topic, and we are sort of
mhm.
analyzing and studying how to incentivize blood donations in countries like the United States or Europe. And as I told you, we also are creating connections for the blood centers to the donors and trying to understand how we can help them. So my feeling is then it's very cultural related.
Mhm.
So probably what drives people in Africa, it's a little bit different than what might be driving people in Europe or in the US. Are social medias involved in the platform? Are you using them to push more towards blood donation, or not really yet?
Thank you, Barbara. So I think just to give a bit of insight about it, yes, social media is very, very important. So we have two main marketing tools. Number one is social media, where we reach out to a lot of young people with a link explaining why it's critical they give blood and they should come up and donate blood. That's number one. Number two is the fact that we also send them information that educated people don't even know what about their blood group, what they're supposed to do about blood donation. So we educate people on social media. The idea is to give more information, and through that information, we can ask them to become part of the tribe. So the first step is to give a lot of information, educate them on blood donation, why they need to donate blood, and there are a lot of misinformation about blood donation. So we want to educate them, and then through that they can sign up. The other one is a traditional way where we partner with mosque, churches, to get people to come and donate a lot of blood. So I believe these are the two main ways, but social media is very, very powerful. And we've got so many of the people to join the Walla tribe through social media alone. Yes.
Good, good. Very interesting. So then you made me think about, on one side we have the donation and the donors, and on the other side we have the blood centers that has to deliver the blood units to the hospital. Or maybe in Ghana, like in Italy, blood centers are part of the hospitals. But still, I am thinking about the other scope of your product, which is connecting hospitals together, because maybe an hospital has blood and it's exceeding the demand, and another hospital doesn't have enough blood. So if I
Mm-hmm.
understand correctly, you are connecting hospitals together so that they can exchange blood and make sure that you always have blood where it's needed. So can you explain me more in details how this part of your offering works? How are you helping blood centers? What kind of technology you use? I guess there's some artificial intelligence involved. So give us some a little bit more details on this.
Thank you, Barbara. So what we found out was that blood have a shelf life of just about 30 days maximum, right? And we realized that some of the hospitals actually throw away blood. It's very painful to give a pint of blood, and because sometimes they don't need it, they throw it away. Meanwhile, it's critically needed elsewhere. So the idea is, why don't we build a network of hospitals? Let's say within a city, let's say even if you take Italy, in Bergamo, in Milan, all the hospitals connected to one network. So that through machine learning and artificial intelligence, like you mentioned, we can make the blood available. So if one hospital doesn't have the blood, all they need is to make a request on the platform. And once they make the request on the platform, we can surely scan through the database. And once we scan through the database, we can actually get them the blood that they need as well. So I think the whole idea is to build a network and a pool of sharing so that every single pint of blood is not wasted, but actually used to save a life. So that's the whole idea behind it. Yes.
Great, great. So, yeah, so this is very important. I guess you are playing a critical role in the transfusion business in Africa in general, because I mean, I remember you explained me more than one time that still there is a lack of blood, so with severe consequences. Like I picture some blood centers or hospitals, they maybe don't have blood. I remember you explaining me that, for example, pregnant
Mm-hmm.
women, that's an important it's an important target group that needs blood, for example, when they give birth to their child, and if they don't have blood they risk to die. So I mean, guess there's a very severe situation, and while it's playing a critical role and a big impact on the market. So I'm wondering, can you explain us a little bit more how the transfusion business works in Africa, and how the blood collection works. Like, I think the system is a little bit different than what it is in other countries. Every country is a little bit different than the other, but how does it work here?
Exactly. Thank you, Barbara. So Europe and the US have a very organized system where the Red Cross take a bigger role. In Ghana, the Red Cross doesn't actually collect blood. So the hospitals over the years have improvised to collect their own blood. So most hospitals, so some of the, you mentioned the pregnant women. And if you are pregnant, when you come to antenatal care, sometimes they ask you to donate blood ahead of time before you give birth. So most of the collection of blood in places like Ghana is all more of uh, it's not necessarily voluntary transfusion. It's more like replacement donation. So they want you to come and replace for the blood that they give you, and that is not sustainable. And that's been the problem over the years. So typically, you walk to the blood bank. Sometimes you join a long queue, 3 to 4 hours, just to give a pint of blood, and then they go through the transfusion process. So I guess it's not really organized in Ghana and many other countries in Africa compared to Europe, where it's a bit more organized. So what Wallet is trying to do is to get people to book an appointment through the Walla app. Once you book the appointment, it goes and it shows on the calendar or the dashboard or the blood bank platform so that nobody's time is wasted and we can help to solve the problem. But the current system is a bit more chaos where every hospital has their own standard. So through Walla, we are trying to make sure that there's one standard across board for all the hospitals. Yes.
Sure. No, that's fantastic. And I mean, congratulations. I think you're doing a
Thank you.
lot and creating a big impact in a great country like Africa. So really, really congratulations. And based on that, I would like to know more about, um, so what's the path that Walla did so far? Are you in a pilot? How many hospitals do you have? How many people do you have in the company? What are the plans for, I don't know, more hires? Explain us a little bit where you are, what you're doing.
Thank you, Barbara. So first of all, I want to thank you and Delcon for your support. It's been very, very helpful in getting us this far. So currently we are a very small team, very 8 people, most of them engineers as well. And the whole idea is to be able to, we've done with the pilot in Ghana. We have 142 hospitals currently sign up. What we are doing now is sort of onboarding them to the second version of the application and get them to pay a subscription for the software. So all these 142 have already used the application. They're excited about it and they're happy to do. In terms of the donors, we currently have almost about 6,200 of them, and they've all sort of helped to. Not all of them have donated. I would say probably about 40% of them have donated blood so far. We're hoping that everybody who is a part of the tribe can donate blood at some point. And our vision by the end of the year, in 12 months, hopefully from January this year, what we set the goals for is to sign on 1,200 hospitals. That's a very big goal for us. We hope we can do that. And then also increase the tribe numbers in 12 months to about 100,000, because the more people we have in the tribe, the more they can donate blood. And of course, get to revenue quickly. And after we finish that, will probably be done in Ghana, and then we'll move on to a country like Nigeria. Nigeria has a population of about 300 million, so it's a huge opportunity and a big country. Recently, we were approached by a state in Nigeria, the Lagos state, if we can white label the software for them. So I believe there's a lot of opportunities even to work not just with individual hospitals, but even with big governments to sort of create a platform where they can use to manage the blood donation across a geographical region. So that's the vision for us, expand to other countries in Africa. And then in the next 5 years, who knows, we can be in places like India. India is in the problem of blood is even worse in places like India. They have a shortfall of more than 2 million pints of blood annually. And we believe if we're able to solve the problem, can extend it there to India, North America, and who knows, even in Europe and America, all can benefit from the technology. And of course, partnering with Delcon, I believe we can do a lot in that space. Yes.
Yeah, absolutely. I mean, that's a fantastic topic. I think there's a lot to do in the industry in all countries because, recruiting blood donors is always a tough job for blood banks all over the world. Usually it costs a lot of money. It might be not cost effective as they want. So I think there's a lot of work that we can do together to help blood centers around the world.
Absolutely.
So
Yeah.
yeah, absolutely, absolutely. So from this point of view, I'm curious. You talked about expanding even outside Africa. So
Mm-hmm.
give us more. So what's the plan? You're looking at India. Are you looking for more round of investment? I know you have a plan of growth for the next few years. So give us a little bit more information on that and an overview of where you see Wala in 5 years.
Absolutely. So I think the two important things we're looking for now is a bit more funding. And also we want to expand the team. We need people who have expertise in scaling businesses like us. So first step is a pilot. The next step is to scale and build it to a full-blown business. So people who have done it before, we'll be excited to get people to help us in that direction. And then also we've got a pool of advisors, which is great, all helping us. But I think what we need critically now is a bit more expertise on how to scale businesses like Wala, and also to get a bit more funding is very critical. We're trying to grow a very lean business, not to sort of overexert and spend so much. We want to be able to build a profitable business. And after we've proven the concept, which is very hard in the beginning and requires a lot of funding, the next step is to sort of get the hospitals to pay, get big organizations, governments to also pay for a white label version, more like an enterprise version of the software. So we really need expertise and people who have done that before. And of course, like we've described, after we're able to do that, then it gives the opportunity to scale. The good thing about Wala is that we are 100% tech. We don't want to build infrastructure. We don't want to compete with blood banks. So we are not building blood banks. We are just using software and technology. And that makes it more scalable, right? So even sitting in Italy, I can send you a link, and through the link, you can register and sign up your blood bank. So and I'll send you a video that shows you how to go about it. I think that's a more scalable model than physically building a lot of infrastructure and also trying to compete with blood banks. But blood banks have done this for more than 100 years, and they know how to collect blood. All we need is to use technology to support them to do better as what they do. Yes.
Absolutely. So Dennis, before we finish our conversation, I would like you to give us a little bit more about your background, because I think you were very modest, but I mean, you have a great background from the medical space, studying in the US, Harvard, right? So give us a little bit, where are you coming from and why you decided to open Wala at a certain point of your career?
Thank you, Barbara. So I used to work in the military as a military physician after medical school. I work in the military. I traveled to places like Lebanon, Congo, Ivory Coast. And then I got bored after 10 years working in the military, and I decided to become an entrepreneur, started a few clinics in Africa, and then went back to school to Berkeley to do public health. And then later also went to Harvard. So actually the idea to start Wala was when I was in Harvard. We got selected as a part of the Harvard Social Change and Innovation Fellowship. And the idea I put across was Wala, because everywhere I traveled, there's always a problem of blood shortage. So my thinking was, why don't we solve this problem? And we got initial funding of about $30,000 through Harvard. And that's how we started the idea of Wala. And then we built it up on this point. And through the support of Delcon and a few other investors, we managed to sort of go through the pilot phase as well. So I think there's a bit about my background and where I'm coming from. Yeah.
Fantastic. Thank you, Dennis. So it was a very interesting conversation with a lot of interesting topics. I mean, transfusion business in Africa, important country, you know, for the future of Africa, how we can support blood donations there. So you're doing really a lot. So my congratulations again. And yes, the cooperation with Delcon, I mean, we have a lot ongoing, and we are happy to work with you and hope to contribute more and more and more to help you build a sustainable blood supply chain in Africa. So really, thank you very much. Was happy to talk to you today.
Thank you so much, Barbara. I mean, congratulations as well. You're doing an amazing work with the Delcon talks. I've listened to a few talks in the past, and I think it's a wonderful goal to go. Maybe, who knows, Wala will also steal the idea and will start something.
Oh, yes. Share our ideas. We are very open, so feel free to do that.
All right. Thank you so much. It's been awesome talking to you.
Thank you.
All right. All right. Have a nice day. Ciao.
Ciao. Ciao.